Why no one is using free COVID 19 treatment in the county. Experts highly recommend people be vaccinated against COVID 19, regardless of the vaccine brand. This is because the best vaccine is the one available to you right now. And if you have concerns, you can always speak with your healthcare provider. But behind the vaccine scene, the cases of COVID 19 remain high, even in some US states. According to the San Diego Union Tribune, San Diego County's health department offered free access to a treatment type for COVID 19. Yet no one seems interested in this silver bullet. Only 49 people were treated in the past month, despite being one of the most hit counties in the US. We are seeing fewer than we think are eligible to receive the treatment, and we want to make sure we get the word out, said Dr. Jennifer Tutur, Deputy Chief Medical Officer for San Diego County. The silver bullet here is the monoclonal antibodies. Although they are not the best treatment for all COVID cases, they are reliable in cases caught early. For those unaware, catching a disease early is the next best thing after prevention. Whenever a disease advances, the chance of getting treated or cured drops significantly. Thus, those with severe symptoms are at risk of hospitalization and death. There are several monoclonal antibodies for COVID, and most show excellent performance. So why does no one seek this kind of treatment? The answer is the stage of the disease. The greatest disadvantage of monoclonal antibodies is their lack of edge in severe COVID-19. However, they offer an excellent prognosis in mild cases. It means monoclonal antibodies should be offered to those who recently tested positive for the disease. The drugs have the best chance of stopping COVID-19 from progressing during the early onset of symptoms, such as headaches and slight fatigue. The antibodies can attach to the coronavirus before it starts going full force. Based on clinical data, casirivimab with imdevimab showed up to 3.3% absolute reduction and 71% relative risk reduction in hospitalization and death due to COVID-19. On the other hand, bamlanivimab with etesivimab expressed a 5% absolute reduction and 70% relative reduction in hospitalization and death. When COVID patients receive monoclonal antibodies early, they are unlikely to bleed money because the risk of hospitalization is likely to drop. Hospitals gain benefits as well due to fewer admitted patients as early intervention was given to mild cases. Plus, monoclonal antibodies can work in vaccinated people.